everyone's attention. I want to thank everybody for coming out today. It's very exciting to see so many faces come out for something that is so important to each and every one of us as Americans. I am Mercedes Price Harry, and I am with the 912 Project, and we are a nonprofit grassroots organization. We're just everyday people just like you guys, and we're a little worried about what's going on in Washington, and we have been for years. So this is nothing new, and we hope that all of you will feel the same and hopefully help us in our efforts in the future or contribute in any way that you possibly can. I would like to start our meeting tonight with a Pledge of Allegiance, if everyone could please stand. We also have several endorsements, one of which is from our Representative Connie Mack, and he has this to say. I am adamantly opposed to a government-run healthcare system. A government takeover of healthcare will raise taxes, ration care, and ensure that federal bureaucrats and not doctors would make decisions about your health. The American people deserve the freedom to choose the healthcare that is best for their families. We should instead look to market-based policies that will lower healthcare costs for everyone and improve access for uninsured and underinsured individuals. A candidate for District 4 County Commission, Levine Kirkpatrick, would actually like to say something.
Be real quick. We also have Carol here from VITAS, which is also hospice. So there's something I wanted to throw into here. We are fighting very desperately in Washington, D.C. for hospice benefits. And we are looking at possibly losing a large part of Medicare hospice benefits. And hospice benefits are some of the least expensive care, as well as some of the most important care that we can give people at the end of their life. So just wanted to say that. That's all part of what we're talking about today, and thank you very much.
So I asked each of you, what does a homeschool mom, a meter reader, and an attorney have in common? And that is that they're all members of the Southwest Florida 912 Project. And we are a grassroots organization, and our mission ultimately is to save our future by preserving our Constitution.
What does healthcare have to do with the Constitution? The answer is nothing. There was an author, an economist and a philosopher named F.A. Hayek. I'll try to summarize his theory, which is centralizing power in a government inevitably leads to tyranny. Because if the government has control over your health, over the ultimate question of whether you live or die, they've got control over you completely.
Our next speaker is our keynote speaker, and he is from the Conservatives for Patients' Rights, and his name is Dr. Julio Gonzalez.
What really triggered my ire and what really got me to motivated to write the book that I did was there was a sentence in there that said that, okay, so now that we've taken over healthcare and we're responsible for taking care of you all, then we should also be responsible for building healthy communities. Just like that. So what does that mean? What does that mean? Does that mean that if I go to buy a cigarette, you won't sell me one because it's not healthy? And is it the government's role to say that? Does that mean that if I do have a little bit extra body fat, and I love potato chips, and I go to my neighborhood grocery store and I go to buy potato chips, does that mean that the grocery store guy is going to have some computer analysis there on me using my social security number and my health records, and is going to say, well, I'm sorry, but you don't qualify for potato chips today, so you lose those extra 20 pounds. I mean, to me, that's what it means, or at least ideally, potentially, that's what it could mean. It was appalling to me that the government, members of the government, misguided members of the government, could use caring for others and could use responsibility for your neighbor as an excuse to be able to go all the way down to our neighborhoods and decide what our neighborhoods should look like. But that's exactly what they want to do. There's going to be a series of folks out there that are going to be making decisions about what I can and what I shouldn't and what I should prescribe to you. So not only is it going to be in the neighborhood potentially, I don't know what that means because it was a blanket statement, it's going to be in the exam room. So anyway, let me just tell you the government's view. I'm just going to take a few minutes to tell you the government's view, and then I'm going to tell you the people's view, and then I'm going to tell you how they're going to control it. Government's view. The present system is too expensive. Next slide. Quality is poor. Next slide. There are disparities. There are neighborhoods where people don't get the care that they should. But that's what the people in control of the government are using to defend their actions. But when you go talk to people in your neighborhood, you really see three things that they're worried about. They're only worried about three things. Number one, it costs me too much money to pay for health care. I feel really vulnerable. I feel, like if I get sick and I get a real bad catastrophic illness, all my savings are going to be gone, and I'm going to have to go bankrupt. The insurance companies are robbing us. That's the third thing. So if you get this one, and you add a distrust of the insurance company, their conclusion is, well, let's hand it over to the government. The government will do better. That's absolutely the worst thing. Because right now, I can like an insurance company and go to another one, and it might be the same thing, but we still got division of power on our health care because we can just move on to another one. If the government takes over it, I guarantee you, there won't be a difference of healthcare provisions. And I'll explain a little bit about how that is. Anyway, all right, so what's it going to do to me? How is it, because Obama comes out and says, whatever, you like what you have, you're going to keep what you have. And he also says, we're not going to interfere or meddle with your health care. Well, let me tell you how they do. PQRI, that's Physician Quality Reporting Indices. We have to fill out whether we did this or that or this. So for example, if I'm an orthopedic surgeon, which I am, and somebody breaks their wrist and it's an elderly patient and it's a woman, I have to be able to talk to her about osteoporosis. Okay? And if I put it on a little check, whether I did or not, if I just put a little check there that says I talked to her about osteoporosis, they'll give me credit. If I don't, they'll cut my reimbursement 10%. That's how they're going to do it. A lot of us don't. And so what they'll do is we'll cut 10% of your reimbursement. No problem. So what am I going to do? Well, I'm going to, sooner or later, they're going to put the pressure on, and I'm going to do what they say. And that's how they control the healthcare. It's no longer about me talking to you and deciding what's best for you. It's the government deciding that this is how they're going to put pressure on me to comply with their cost-effectiveness research. It's cost-effectiveness. It's not quality, it's cost. So what it is the government is going to get together and they're going to create this computer program, this massive software, and I'm supposed to put in not only the fact that I put my little check mark, but how you did it. Okay, my lady with a hip fracture, I used this device to get her to walk again, and she can walk a mile. And it cost me however much money. My other patient, my buddy across the street, he used this device and it cost him whatever. And so what the government is going to do is they're going to take all that information. They want it to be a way of measuring outcomes and measuring interventions so that they can compile all that information together, give me numbers, and tell me, listen, we're going to pay you 10% more if you use this device. If you don't use this device, we're going to pay you 10% less because it's cheaper for us. And that's for me in orthopedics. It's going to be the same thing in blood pressure medicines. It's going to be the same thing in cholesterol medicines. That's what cost-effectiveness research is. And the natural progression of cost-effectiveness research is to control the way we take care of you for cost. Not for quality, not to handle your concerns, for cost.
This is an administration that wants to change the social contract that we have in this country.